Yeehaw. Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
Together
therapist.
we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, Brad, we're going to talk about, is your dizziness vertigo BPV? All you have to answer is 4 questions to know.
Right. So if you answer these 4 questions, you answer yes to them.
It's a good chance.
It's very likely, right.
What is BPPV? Do you want to say it?
Benign proximal positional vertigo, Bob.
Wow,
it's a
really
mouthful.
well done.
There you go. I've been studying,
A
Bob.
common vertigo, a common source of your dizziness, a common vertigo.
Right.
So, and the really good thing about it is, I don't know if I can say this already, Brad, but it's very treatable.
Right, without meds.
Without meds.
And simple.
And sometimes it's one treatment,
Mhm.
and I've seen it where it's been one treatment.
Oh,
and it
I've
went
done
away.
it many times
Yep.
myself.
Exactly. Well, don't brag.
Well, I just thought I'd kind of wave my flag or whatever you say.
All right, if you are new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, you're going to want to go over to at least to the Facebook for sure, Bob and Brad, because we're doing another giveaway right now. We're doing a Flex-A-Spot. It's a desk riser, right? Yeah.
Hold on to that, Bob.
He's going to show.
Yeah. You can put your computer on there on your desk and you can raise it and lower it so you can sit or stand while you work at your desk, relieving back pain, getting the circulation going. You just feel better with
But show how
that
portable
option.
it is.
Yep. We lock her down.
Way to go, Brad.
There we go. And we got a handle right there. And you can carry it around.
Yeah, which is a lot of desk risers you can't do. I also want to mention Instagram. We just went on to Instagram, official Bob and Brad. Make sure you join us over there. We got some cool little clips that we're going to put on there. And we're going to start putting some pictures on there too.
Sure.
Of our ugly mugs.
Well, yeah, who knows what will happen at that point in time. Anyways, let's talk about some
Let's
dizziness.
talk about it, yeah.
So vertigo is, a dizziness. You can get nausea, lightheaded. There's lots of symptoms. But one thing that we always have to be concerned about as clinicians, as well as people who have this, is there's a lot of other things that can cause similar.
A huge amount of things. And that's why, it usually starts off with your doctor trying to diagnose what, narrow it down. What is causing your dizziness
Right.
or spinning?
So do you treat it with physical therapy, with medications, or whatever it may be?
Right.
A few examples of problems that do cause similar symptoms is Meniere's disease.
Meniere's disease,
Okay.
yeah.
Hypotension, low blood pressure,
Right.
or possibly hypertension, high
Right.
blood pressure.
Either one could.
Hypoglycemia,
Very common.
blood
That
sugar
is
issues,
running low.
right? TMJ issues relate right close to the vestibular system. That can
throw
roll
things
over
off.
into
Yep.
that. Medications, sometimes
Very common medications.
side effects.
Yeah.
CVA or stroke,
Right.
can relate to that.
I
mean,
have a lady right now who, she had surgery on her brain
Yeah.
tumor, and when they took it out, she's been dizzy ever since.
Sure.
And so you
Right.
obviously probably related to that.
Right.
But medication is very common.
Right.
I see that quite often. They might have too much or too little of some type of medication.
Sure. So now
So-
that we've mentioned all those, you kind of wonder, what chance do I have of knowing?
Right.
Well, there are the 4 questions we mentioned we're going to go through in just a little bit. Oftentimes, it's going to narrow it down.
Yes, it is.
It's not 100%, but it gives you a real good indication.
A real good start.
Right.
And it's hard sometimes because I think you're going to mention, Brad, is that a lot of times these are misdiagnosed
Mhm.
and or they're not caught
Right.
until maybe it takes quite a few doctor visits.
Right. As a matter of fact, VITA, the Vestibular Disorder Association, did a benchmark study, and they found an average of 4.4 doctor visits before
It took that many.
they got the proper diagnosis
Right.
to weed all these things out. And a lot of it depended on the very first visit. If the first visit was incorrect, then it draws it out quite a bit
Sure.
longer, because the doctor, if they diagnose it right immediately, say it is BPPV, and they send you to the therapist, well, that's it.
Right.
But if they don't, and
then they're going off into the wrong direction here.
Right.
And who knows where they're going.
it just takes longer, and eventually it all works
It
out.
shows you need to stick with it, though. I mean,
Right.
if you have dizziness and you're not getting an answer, you got to keep mentioning it to your clinician, and at some point maybe even go to a different clinician.
Right,
I mean,
or your
serious.
doctor, you mean?
Yeah, to my
Right,
doctor. I'm
right.
saying clinician.
So the 4 questions, this is what people have been waiting for. They're
Right.
probably saying, quit babbling on. But
And
anyways,
these are from the Dizziness Handicap Inventory.
right, and
Yeah.
it's a form. There's like
Right.
35 questions, and there's 4 of those questions that if you answer yes to those 4, then you likely have BPPV.
BPV. Okay.
The first one, does looking up produce dizziness or your symptoms? So if you simply look up, do you get that dizziness? And
I actually get a little mild form of that sometimes, just looking up.
right. So that's why you have to have yes to all four
Right,
of these.
exactly. Because the
Right.
rest of them don't bother me.
Sure.
So
The next one, number 2, does quick movements of the head increase your problem?
so you can even do this and
Right.
see, does that make it worse?
Right, exactly. It could be
So-
side to side, up and down. If that one's yes, you go to the next one. Does turning in bed increase your problems, or just rolling over
Sure.
to produce? Now,
And
often,
I've seen that. I mean, that on the ones I'm treating, it's almost universal,
Right.
100%
And
that
it's
they have trouble with that.
typically one direction,
Yep.
not the other.
Very good point. Yep, it
right.
tends to be one side. It's
Yep.
not, especially if you pay attention, you'll find out it's always to the left or it's always to the right.
Right.
So,
So if that one's yes, then the last one, does bending over increase your problem? And a lot of
so like
times,
reaching to the floor and grabbing
right,
something.
Yep, here, bending over like that. It could be if your head is vertical and you go down like
Sure.
this. That motion is
And you can see why this is so dangerous then too, because you're bending over to pick something up, you get dizzy,
right.
down you could
Right.
go. So this is, not something to be messed with. I mean, you
Right.
want to get to the source of the problem, because this can result in many falls.
Right. And for a lot of these people that have this, it's very, very disturbing to
Right.
have it. It gets
Very
you
scary.
nauseous, and actually you can vomit
Yes.
if you have a real bad episode. Now, the thing with BPPV is they don't last usually more than a minute or so.
Right.
And if it goes on for minutes or even hours, it's not
It's not BPV.
right. And
exactly.
right. So, and that's
You might it'll last a minute and you still might feel weird after that,
Right.
but the actual dizziness or spinning probably doesn't last that long.
right.
And by the way, we do have videos on how to treat it using the Epley maneuver,
Right.
so you can see how it's done. We actually did one with a live patient.
Sure.
I mean, a real patient. I should say a live patient. They
Right.
weren't dead,
yeah.
but
Yeah, and she was very completely successful.
yeah, it was kind of cool, because it was a girl that worked for us, and we did it right on camera, and it went away, and
Right.
and it stayed away.
Yeah,
So
so it
was
worked
kinda
out.
cool.
Win-win situation for everyone. Yeah, so it's a really good idea to see a therapist that does this treatment
right,
and go through it. But then I've had people, my patients, I say after they go through it and they have no problem doing it, I say you can do this at home
on your own.
by yourself. And
Yeah.
I've had people do that. But I would say 80% of the time, or even more than that, I've had really good success with the first treatment.
Yeah, or and it may come back not as strong, and then you just repeat it
Right,
again.
right.
So I mean,
Now, I just the course that I'm taking, this clinician's therapist, she'll actually go through the maneuver 2 or 3 times right there. That
I do
first day.
too.
You do?
yeah, I
Yep.
quite often do it to see if it kind of sticks.
Right.
But yeah, I don't hesitate to do it more than once.
Sure,
that's for sure.
Sure. Yeah.
So-
So if you're wondering what we're talking about,
Yes.
just go to our video on the Epley maneuver.
Canalith repositioning technique, I think they also call it. But
Right.
it's
That's,
Epley
that's a
maneuver.
good point.
Yeah.
There's
Different names
Yeah,
for it.
there's different names for the similar treatment, and
Right.
it's same with some protocols. Different therapists do things slightly different. It all boils down to
Yeah,
does
you're
it
getting
work?
trying to get the crystals in the right spot.
Right.
There, so.
Yeah, those rocks in your head.
Yeah. So, all right.
Once again, Bob, I think this relates to getting one step
I don't
closer,
know how, but see, we can fix just about anything.
except for
A broken
there
heart.
you go.
But we're working on it.
And we're not going to stop, Bob.
I know.
This is a good step in the
You
right
don't have to
direction.
tell me.
I'm going to take a continuing net on that.
All right. Thanks for watching.